What AI will deliver is a level of productivity we didn't know was possible. We're 9 people and we're supporting hundreds and hundreds of conversation and clients. Like 5 years ago, if we were building this company, there's no way we're 9 people, right? I think the future of work is going to unlock the creative side in us. It could be anywhere, right? It's like this concept of productivity and creativity coming together is the future of AI and work.
Hi, I'm Boaz, founder and CEO of Augmented AI Labs, and I'm excited that you're tuning in to the Shift AI podcast, a show that explores what it takes to thrive and adapt to the changing workplace in the digital age of remote work and AI. In today's episode, I'm thrilled to have Rohan D'Souza as our guest. As the co-founder of Avante, Rohan is tackling one of the most complex and opaque systems in America, employer-sponsored healthcare. With his extensive background in healthcare technology, from working with electronic medical records during their early adoption to now leveraging AI to democratize healthcare information, Rohan brings unique insights into how technology can transform this $1.7 trillion industry. If you're interested in how AI is creating new possibilities in healthcare and the challenges of navigating a highly regulated industry as a startup founder, you are not going to want to miss this episode. We also want to send out a special thank you to Augmented AI Labs for sponsoring this episode. This is going to be a great show, and we're super excited to talk to Rohan today. Let's get to it. All right, Rohan, thank you for being on the Shift AI podcast. I'm really excited to talk with you today.
Thank you for having me, Boaz. I'm super excited to talk to you as well.
Right on. Well, I want to talk about your background a little bit. You've been in the healthcare space for a very long time, startups and really experimental kind of stuff. Can you talk a little bit about the history, and then we'll dive into the startup that you're working on right now?
Yeah, I'll give you as quick as I can. I was a science nerd growing up, more on the biology side, never really on the chemistry side. Which means I was more interested in the human connection rather than the science behind the human stuff, and thought I wanted to be a public health researcher. And so I was pursuing that track. I was a kid who grew up in India. I came here for undergrad, and I was graduating at a very, very interesting time. I graduated at a time where there was a massive financial crisis of 2008.
Yep.
While at the same time, there was a crazy opportunity happening in healthcare where the government was incentivizing the supply side of healthcare, primarily doctors and hospitals, to digitalize an archaic manila folder-based system.
Yeah.
And so I was like, oh my God, like there's no jobs available because of what's happening on the financial crisis, worst time to graduate. While at the same time, there's this huge industry like blowing up, right?
Yeah.
With electronic medical records. So I was super fortunate that I took a job at one of the leading electronic medical record vendors. And that is what just really pulled me into everything that is quote unquote messed up about the American healthcare system, right?
Yeah.
Systems don't talk to each other, perverse incentives, et cetera, et cetera. And I just threw myself at every big problem that came my way, not being afraid about it. Maybe this is the first generation immigrant characteristic or personality that came to bear. And I did a whole bunch of things, which means travel to places in America that I didn't know exist to talk to them about technology in healthcare, while at the same time, figure out how are we going to build a sustainable, thriving system. So that's, having done that and continue to do that, I still continue to be just really attracted by the massive problems that exist in the healthcare space.
Yeah, that's interesting. Well, we share two things. One, we're both immigrants, and two, we were both college athletes, right? So just for the audience so that they can get a little color on your background, what kind of sports did you play?
I was a swimmer. So I swam professionally, or I guess semi-professionally. I was an Indian national swim team, and I was getting recruited by a bunch of colleges. And my only path to coming to the U.S., I come from a pretty middle-class family in India. And it's like, hey, we can't afford an undergrad education in the US, but there's this thing called a sports scholarship. And if one of these universities give you a scholarship, then you can go. I was the first Indian to ever go through the NCAA clearinghouse for a swimming scholarship.
Oh, wow.
There have since been others. And lots of stories about that. So that's my athletic background.
Yeah, it's interesting. I always like asking founders, because I find that there are a lot of founders that had sports in their background. It's very common. Well, let's dive in to talk a little bit about the new company. I'm really interested to hear, because it's still pretty early and you're just kind of getting it going. Can you talk about where you are, like what stage you are in, the name of the company? Talk a little bit about how you're helping businesses and what you're doing.
Yeah, so thank you for the question. We've been on this journey for a little over a year and a half, building Avante. Avante is the root of the word is Portuguese. It means to move forward, or what I like to say, charge. I thought I had some Portuguese in me with a last name like D'Souza. It turns out I actually don't. It was just the Portuguese who came and colonized a part of India. But, my co-founder, Kabir, when we were sitting down to think about the idea, having him being a multiple sort of series entrepreneur, saying, Rohan, I don't care what you call the company, but it has to start with A. So I said, okay, but you do care then what we call the company. So what we're really motivated by is, one, it's a massive market. It's a huge, huge market. When you think about the American healthcare system, about a third of it comes from government-sponsored plans. And then a little more than a third comes from what you and I typically have experienced, which is employer-sponsored healthcare. It's sort of the first thing that happened in the American Healthcare Recovery Act, which is, hey, employers can take advantage of tax incentives to allow for their employees to purchase healthcare services that they get to dictate. What's happened is the cost of that purchasing that is happening from these employers is reaching, and for actually some time now, has reached an unsustainable rate. It's anywhere from 8 to 14% year over year.
Wow.
And as we were thinking about having, with my background on the supply side of healthcare and understanding all of the complexities, a lot of our roads were leading back to the demand side, which is how do people, one, purchase these really expensive services? And when they're purchasing the services, do they have the visibility to tell them what's actually working versus not, so that they can alter and change their purchasing decisions? And turns out for employers, it's a completely opaque system. It's $1.7 trillion. And we said, like, look, we're in this amazing time with this technological revolution that's occurring with AI. How do we take advantage of this moment? How do we take advantage of the fact that a lot of the infrastructure to do really good AI has already been laid? Employers have already spent billions of dollars on HRIS systems and payroll systems and ERP systems and communication platforms. But yet the spending that's occurring on this line item is super, opaque. There's not a lot of visibility, while at the same time, the people who are consuming these services are totally confused. When was the last time you met somebody in a social circle that said, like, oh, I fully understand the insurance plan that I've purchased and what's available? Like, nobody, right? Nobody does that. So we're like, okay, I think there's something to be had here. And, it's a market that all the things that SaaS entrepreneurs and investors care about. Is this a market that's big enough? Has it reached an existential point? Are there interested parties that are willing to do something early with you? And do you have the right team put together? And so we found ourselves through a lot of hard work, having all of those things lined up, and said, let's go and let's build something that will have a meaningful impact, that we can look back and say, okay, we actually applied AI in the right places to drive positive change.
So let's talk about how that plays out. So let's say that I'm working for somebody, they offer me a plan, super complicated. I don't really understand until I have to, and something happens to me, like what exactly is part of this plan. So how does that play out for you, and what's the opportunity?
Yeah. So status quo today is you hope that you have a friend who knows all the answers to your questions, because you don't want to ask your HR team the questions that you really want to ask. Or B, you get in line on the phone with the insurance company. And most of the times in employer-sponsored healthcare, the insurance company is not who you think it is. The insurance company is actually the company, because they self-fund the insurance product. They're just renting the network from a large insurance provider. And so it creates this like really convoluted, confusing thing. Second problem is, more often than not, you are thinking about healthcare and insurance not during your traditional working hours. You're thinking about it when you're sitting around the dining table, with your significant other or your family, or when you actually have the time to think at a time when HR isn't around, right? They're not around to answer those questions. And so what the opportunity for us is, how do we take all of the information today that exists inside of these organizations and completely democratize it and meet the employee where they are at, which means likely at a 6th grade or 8th grade intellectual level of insurance in America. They might be the smartest engineer, doctor, lawyer in their trade, but when it comes to understanding what's covered versus not covered, these guys, you and I aren't insurance experts, right? So AI presents this incredible opportunity to meet the person where they're at. And second, to do it really fast because this infrastructure is already laid.
Yeah.
And we're obsessed about enterprise, right? We're not building a consumer business. We're building an enterprise business, which means bringing in all of our background on understanding how to do SSO the right way, how to show up in the right place, how to do really good reporting. So your HR stakeholders like, okay, I turned this thing on. What's it actually doing for me? Because we come from that background, we have implemented the things in our product to do those things that your enterprise buyer just cares about, right?
Yeah. Yeah. So for the consumer, I have an expert in my pocket. And when I have questions about anything related to my healthcare, it answers those questions. So I become a happy customer. I'm getting well served. In terms of the employer, like what's the incentive for them to get excited about implementing this solution?
Yeah, really good question. So most of employers today have spent an excruciatingly large amount of time designing a benefits packet or a package for employees to consume. And the reason why they've done that is all to do with cost containment at this number that's increasing 8 to 14% year over year, while not compromising on the employee experience. There's a very easy way to control cost. Give a really shitty product. Nobody's going to do that, right? You won't have a company. And so the incentive for the employer is, first, HR is a cost center. Finance is not going to give, a CHRO a crazy budget to just hire more people to take in all of the inbound that comes in. Incredible opportunity for AI to help solve for that lean operations, unit inside of an organization to infinitely scale. So that's the immediate low-hanging fruit on the ROI. And then the second is, if you can drive the appropriate utilization of benefits, which is counter to your thinking, it's like, if I can actually increase the utilization of a virtual physical therapy benefit that your employer has provided, that prevents you from having to go to a more expensive care provider, it's a huge amount of savings, right? Crazy stat, Boaz, like 81% of Americans are overinsured. Why? Because the one day where you make the decision on your plan selection, you completely forget about cost because you feel like you have a gun to your head and you're intimidated by the complexity in the system, and you pick the exact thing that you picked the last year, which is likely a PPO plan, right? It's super expensive. You're a low utilizer. Your employer is paying a lot more as a proxy premium to cover that PPO. When really, if AI did its part to educate you about the benefits of a high deductible health plan with a health savings account that has a triple tax benefit, that's actually money back in your pocket. It's not just money back in your pocket, it's money back in the employer's pocket. Yeah. And so that's the real promise of what I think AI and AI agents that are running around that are hyper-specific are going to solve for employers.
And is that something that you guys are a proponent of, HSA type of accounts with high deductible? I mean, is that just one option for people that are of a certain age?
Yeah, that's like one option. So we're not a steerage play, right? We are in the service of, super tactically, it's how well the prompt is engineered, right? But now meeting the people where they're at. So a really sophisticated individual is, so actually I'll take a step back. This concept of ROI that everybody in AI is trying to figure out. The real struggle is you are comparing in typical software implementation, right? You compare against a baseline. Well, what is the baseline for AI? The baseline for AI is a human being, because AI is going after the labor market, right? When you think about HR, What's happening with the AI world is the types of conversations that are occurring between a human being and an AI agent are totally different than the conversations that were occurring between a human being and a human being. Because now you're able to ask the AI the types of questions that you previously wouldn't ask a human. It's like, I'm not going to ask you if my FSA will roll over if I decide to quit working here in the next 2 weeks. Like, you wouldn't ask HR that.
Yeah.
So this example of the HDHP is one where, depending on what the employee is asking of the AI, it will take all of those things into consideration. It will look at the HRIS feed. It will look at the previous utilization to say like, oh, Boaz, you're actually a low utilizer because you allowed me to look at your previous utilization. You look like a pretty healthy person and you're doing your preventive services, which is amazing. You don't need the PPO, buddy. Like, just pick this and you'll benefit from the fact that you can implement versus, hey, I'm a cancer patient. I have a lot of infusion therapy. I would not recommend the high deductible health plan in that example, right? Because I would tell you about the reasons to select the more expensive premium, because at the end of the day, you're going to save money, right? So
that's interesting.
hopefully that makes sense.
Yeah, it does make sense. What do you think about privacy? And in turn, if I'm going to share information, let's say I'm getting ready to leave this company and I need to understand information about my health plan. I mean, ultimately, this is a tool that the HR company is purchasing. I mean, they own that information that I'm chatting with. So how do you think about that?
The short answer is we're still in the first innings of figuring that out. But there's a couple of things that we have taken a pretty strong stance on. When we are communicating with an employee, as part of our privacy policy in terms of service, we say that the information that you talk between yourself and the AI is fully protected and anonymized to anybody, even Avante and the employer itself. There are a couple of ways where your information that you share becomes available for further interrogation, which means if you explicitly state, I want to provide feedback, then the system gets, or the conversation gets shared with the stakeholder on the employer side, because sometimes what happens is the content is king, right? In these world with AI. And what AI is actually doing is it's telling stakeholders that your content is actually old, which is why the AI response was quote unquote incorrect. The AI response actually not incorrect. It just referenced a file that you should not have had in the first place, right? So in those situations, the conversation might get ended up shared back with the HR counterpart or the benefits counterpart, but purely based on the explicit consent and sharing of the employee. We've actually seen in the utilization of our product on the employee side is many times the employee, when they're having a conversation, they will say, can you confirm that this conversation will remain private? And my HR team doesn't. And the model will spit back out and say, as in our terms of conditions and privacy policy listed here, it is fully protected.
Yeah,
right?
that makes sense. It's tricky, isn't it, though? And you're dealing with that kind of information.
Yeah. Yep.
So how about, as you think about the challenges that you face, talk about the stage that you're in right now and where you are with fundraising and just some of the things that you've experienced, not just as a founder, when that's hard enough just to be a founder, but you're in a very highly regulated industry, a very complicated industry. So can you talk a little bit about, kind of what you're going through to other founders out there in the audience?
Yeah. So first of all, you have to be ready for everything that will be thrown at you on like, oh my God, insurance is super regulated. Healthcare is even more regulated. I honestly thrive on all of those things because what bigger market do you have than 1.7 trillion that, tomorrow when you and I catch up, that number is going to be 1.71. So the market that is being provided for real innovation to happen is massive. Yes, there are challenges with your classic enterprise buying cycles, especially when human beings are involved. But the appetite to implement AI inside of the enterprise has never been bigger, and craving for a solution, right? So the challenges that we had a year ago are very, very different than the challenges that we have today, right? The challenges that we had a year ago was finding the people who are willing to take the bet early on in the future state. The challenges we have right now is educating our buyer on things that you and I just talked about: privacy policy, governance aspects, et cetera, right? I'm a firm believer that these agents that are going to be running around, there's not going to be one agent that rules them all. There's going to be this very interesting communication paradigm that's happening where, Microsoft just put out a huge article about this. Obviously, Google with the announcement of A2A and, Anthropic with MCP. What's going to end up happening is there might be a new UI for AI created, but behind the scenes, a lot of these agents that are going to be hyper specialized on specific large verticals, right? Take insurance, reading a 780-page document that merges with previous utilization. And that's the part that today, if I were to talk to founders that want to enter the space, is if you want to really crack it in this regulated market, you have to be ready to invest in the education to your buyer, because they're struggling. They're struggling to tell signal from noise.
And now, before we dive deeper, I want to take a quick moment and tell you a little bit about one of our podcast partners. As a listener of this show, I know you're trying to stay on top of all things AI and tech, which is why you have to check out the amazing GeekWire podcast, produced by GeekWire and hosted by Todd Bishop. It's a treasure of insights featuring industry leaders and the latest tech trends that are shaping our world, and the perfect companion podcast to shift AI. GeekWire podcast is where technology meets curiosity and covers the world of technology, startups, and geek culture. Expand your tech horizons and join the conversation. Tune into the GeekWire podcast today, a perfect complement to our own discussions here. Don't miss out. Follow the GeekWire podcast on Apple Podcast, Spotify, or your favorite listening app. Before we go further with the interview, I want to tell you about one of our podcast sponsors, Augmented AI Labs, and how they're transforming businesses through intelligent AI solutions. Augmented AI Labs specializes in helping organizations unlock their potential with Gen AI, starting with your most valuable asset, your business knowledge. Their comprehensive process begins by identifying critical workflow challenges and knowledge needs, then building custom solutions that make your company's expertise instantly accessible. The Augmented AI Labs team combines fine-tuning and retrieval methods to ensure your AI solutions truly understand your business context. They thoroughly test and validate each solution, ensuring it delivers measurable value before creating a detailed technical blueprint for deployment. The real beauty of partnering with Augmented AI Labs is that they don't just stop at strategy. They build, deploy, and manage these solutions for you, continuously improving your knowledge systems while you focus on what you do best. If you're ready to transform how your organization leverages AI and knowledge, visit augmentedAIlabs.com and click on the Contact Us button. That's augmentedAIlabs.com. Now back to the episode. Well, let's talk about the buyer a little bit, because I'm sure, given your co-founder, that you guys are thinking a lot about the early customers and how to create momentum. So can you share with us who are some of those folks and how you're thinking about going to market?
Yeah, for sure. So we're in a very fortunate place in that all of our customers have shared quotes publicly on our website, and we've had them on videos. So yeah, so we found an early group of customers. We created a cohort called Founders Club, and we sat around the table with a number of interested buyers and say, this is a unique opportunity. As a company, you get to do this only once. You get a seat very early on. You get to inform the product. And the benefits are, we're going to spend venture dollars to build out a really great product. And we're going to probably spend way more than the contract value. But the benefits that you're going to get is a world-class team that we've assembled, people who deeply understand this. So companies like Zscaler, Real Chemistry, DataVant, One Digital have all committed to going on this journey with us, and now are seeing their investment pay off, right? And their investment was primarily a really engaged stakeholder and time and a passion to solve this, right? These are people who have spent decades in this industry trying to figure this out. And yet every 2 or 3 years when they go into strategy planning, they end up talking about the same things. Yeah. How are we going to control cost? And how are our people not going to get burned out? The people that we support, right?
Yeah.
And I was like, I don't know if I have the ultimate solution for you, but I'm committed to, obsessing about figuring out a different solution. And obviously we're AI native and, we're going to do this as an AI first
Yeah,
approach.
that makes a lot of sense. It's so nice to have that early founder circle to inform and provide mentorship. These are folks with a ton of experience and they can really offer a lot to the product at the early stages. Tell me a bit about other mentors in your life. Like, who do you think about when you think about folks that maybe in the past have coached you or currently are mentors? Talk to me about that.
Yeah. So I feel like, you go through mentorship. There's some like that will stay with you forever, core memory. I think I talked a little bit about my upbringing. I'm a kid who grew up in India, both working class parents, both who ran their businesses and just worked their butt off. And so just like seeing that every day, I didn't appreciate it when I was, a little kid running around. But now as I look back and as a dad myself, I'm like, okay, I now understand like what my mom went through when she was a chef running a corporate catering business, or my dad trying to stand up,
Yeah.
a mechanical engineering distribution business, like all of the stuff that they had to uh, do in order to support both the family and also like they're 100%, my role models. Number
Yeah.
one. Number two, my swimming coach growing up was a huge role model to me. Taught me he really taught me how to handle stress.
Hmm.
And it's honestly a consistent thing I now hear. It's like, wow, Rohan, I'm sure you're like a duck floating on the lake, but you never really show that. So I have a lot to thank for him. Another one that comes to mind is I talked about this place I worked for 8.5 years. The CEO there, for some reason, the guy just threw me all the hard problems. And now as I look back on it, maybe he saw something in me that I didn't, and exposed me to things, as I talked to what at that time I was 24, 25, 26. It's like, how were you in that room? I was like, yeah, how was I in that room? And most recently, just learning from Kabir. Like Kabir has having been through this journey now, 10 plus years, has stepped on all the possible landmines that can sort of coach me and guide me. So we have this like really interesting co-founder partnership where I'm very clearly the guy with the hands on the steering, but at the same time, there's not this annoying backseat driver, but actually telling me is like, hey, okay, there's this thing coming up.
Yeah.
You might want to do it this way, right? So that's been really wonderful.
Yeah, that's awesome. Well, I always like to end the show with the same question. And the question is, when you think about the future of work, the future of AI, how would you describe that future in 2 words? And then you can elaborate.
Yeah, gosh, that's such a hard question. And even though you asked me this in the prep, I still thinking about it. So for me, the 2 words, they don't necessarily go together. But the first thing that comes to me is productivity. Productivity for me, I think what AI will deliver to us is a level of productivity that we didn't even know was possible. I mean, we're 9 people and we're supporting hundreds and hundreds of conversation and clients. Like 5 years ago, if we were building this company, there's no way we're 9 people, right? We're a lot more people to support the amount that we're doing. So the productivity component is huge. And then the other one is creativity. I think AI, the future of work, is going to unlock the creative side in us. And it could be anywhere, right? Creativity in um, generating decks, to convincing a skeptical buyer. So it's like this concept of productivity and creativity coming together is really what I think the future of AI and the future of work holds for us.
Well, I'm really excited. I think that the industry that you're going after is so big, so complicated, and the opportunity is so huge that anybody that solves even a small part of it is going to win. And so I think it's an interesting one to go after. And yeah, as a startup, you have to go for the big win. So I definitely applaud you, and I'll be looking closely to see how you guys operate in that space. I really appreciate you being on the Shift AI podcast. And if people want to reach out to you, how do they do that?
First of all, thank you for having me, and we'll take all the help and the good vibes sent to us. Yeah, we're going after a pretty huge space with massive incumbents, but we got a really special team, a really motivated team, and we got some really great values. So I'm super pumped to get going and solving this. Best way to get a hold of me, I'm pretty active on LinkedIn. It's Rohan P. D'Souza. I was pretty active on X/Twitter. I now do mostly reposting, but LinkedIn's the best place. Or hit me up on email. I'm at rohan@avante.ai. You might see me walking around coffee shops in Seattle if you're local to the Seattle area, but that's the best way to get a hold of me.
Awesome. Thank you, Rohan. It was really, really great talking with you, and all the best. We'll talk soon.
Thank you. Thanks for having me.
That's a wrap. Thanks for tuning in. Such a pleasure to have Rohan as our guest on today's episode. His insights into the complexities of the American healthcare system and how AI can make it more transparent for both employers and employees gives us hope for meaningful change in this critical industry. From his journey as a former competitive swimmer from India to his vision of AI delivering unprecedented productivity and creativity, Rohan reminds us that the biggest problems often present the biggest opportunities for innovation and entrepreneurship. If you want to learn more about Avante's innovative work in healthcare AI or connect with Rohan, you can find him on LinkedIn as Rohan P. D'Souza or email him at rohan@avante.ai. I continue to be amazed by the guests we've had on the show, and I'm excited about the ones joining us in the near future. I truly appreciate you spending your time with us. Thank you for listening to this episode, and don't forget to subscribe to the Shift AI podcast for more exciting interviews and to the Augmented Edge newsletter for updates on how AI can help you scale your business. The Shift AI podcast is syndicated by GeekWire, and we are grateful to have the show sponsored by Augmented AI Labs. Our theme music was created by Dave Angel.